Good afternoon. Thanks for joining Family Caregiver Alliance for Tech Tools for Caregivers. I'm Calvin Hu, Education Coordinator at Family Caregiver Alliance and your host. For 4 decades, FCA has been working across the Bay Area and the nation to improve the well-being of family caregivers. We offer support through consultations, classes, workshops, publications, retreats, research, and advocacy. If you'd like to learn more about us or access our online resource center, FCA CareNav, please visit caregiver.org. Now, we're also going to be asking you to give a little bit of feedback after the webinar ends, and we do use this to shape future education programs, so I'd like to thank you all in advance for filling those out. Today, I'd like to welcome our guest, Christina Irving. Christina is the Client Services Director at Family Caregiver Alliance. She oversees the staff of the Bay Area Caregiver Resource Center, who provide direct services to family caregivers, which include assessment, counseling, education, and support. She's been with FCA for 14 years, first as a family consultant and then as a clinical supervisor. Christina received a master's degree in social work from San Jose State University and is a licensed clinical social worker. So now that you know a little bit more about today's guest, I'd like to turn things over to Christina.
Thanks, Calvin, and welcome everybody, and thank you for joining us today. I know this is a even more relevant topic in today's times than normal, with the increasing reliance on technology and people being able to connect virtually when they can't always connect physically. So hopefully some of the tools and ideas we talk about today will be useful. As we get started, we're going to share a quick poll just to get a sense of what are the types of challenges that you face as a caregiver that you might be looking for different technology tools to help facilitate the daily activities and tasks that you're doing. So if you can take a moment and answer this question about some of the challenges that you're facing. We're going to talk about all these different areas today, but depending on how people respond, I'll try and maybe focus our conversation a little bit on one area in particular. So if you want to just take a moment and answer those questions, and we'll give you all just a couple more seconds as we get going. Today, I'm going to be talking about technology tools, both in kind of the digital technology space, but also some of the more kind of low-tech tools, so that hopefully we'll get a range of the types of tools and technologies that might be helpful for you. We do have a handout that we'll share after today's webinar that we'll send out and we'll include on the recording on our website that does list specific examples of tools. And they are just examples. They're not an exhaustive list and they're not recommendations, but just to give you a starting place and to have done a little bit of the homework for you. So let's go ahead, Calvin, and maybe let's close this poll. Hopefully we've given enough time. And let's see what people responded with. Okay, so we've got a good number of people who are looking about managing medications, healthcare management, hearing, vision, speech problems, keeping the person you're caring for active and engaged, a few more around personal care tasks and daily tasks, wandering home safety, and getting help and emotional support. So it looks like all the areas we're going to talk about today are helpful. And so hopefully this will give you some useful information. All right, thanks, Calvin. So let's go ahead and kind of get into this a little bit more if we want to go to the next slide. And we're going to give you a sense of how do you make a decision about what tool is going to be most helpful for you. And so starting with what we just did is, what are your major challenges or needs? You really want to start with what are the things that you think would be helpful for you, as opposed to just looking at every single technology that exists. So these are the categories that we'll go through today, but you really want to think about, coming from your situation, what's going to be most helpful for you, and what would you want a technology tool to do for you? And we want to think about what's realistic. There's probably not a technology out there that is going to make your family members help out more when they don't want to, or to make you all come to some common agreements, but they might facilitate communication and facilitate coordinating care. There's not great technologies that are going to maybe stop somebody from falling, but it might alert you that they have had a fall, or they might alert you that somebody's getting up and moving in a way that might contribute to a fall. So really think about what your goal is. What would you like it to do, and what would be helpful for you? And again, if you're thinking about your situation, you really want to also consider, are you living with the person, or are you caring from a distance? Whether it's across town or across the country. If you know that somebody fell and you can't easily get to them, what are you going to do with that knowledge? So not every tool is going to be appropriate depending on what your caregiving situation looks like. And we also need to take into account whether the person you're caring for has some cognitive impairment, and to what extent. Again, there are tools that are going to be helpful with reminders, but for somebody who has more advanced dementia, even a reminder to take their medication may not be sufficient. So depending on whether they have cognitive impairment and the level of impairment they have is going to make a difference as to whether or not this is actually going to be useful for you. There are a lot of great tools out there, but if it doesn't actually work for you, then it's not necessarily going to be helpful. So really keep that in mind, the lens of your current caregiving situation, so that you can evaluate what we talk about today and whether it will be useful for you or not. And if we look at the next slide, you'll see, like this is, don't worry, technology will save you. Again, there's a lot of great tools, a lot of things that I think can be really helpful for people, but they're not going to fix everything. And so we want to be kind of realistic about how it might help us or not. And as we go forward, if we go into the next slide, what are some of the other elements to think about? And one of the big ones that we hear from people is cost. There might be a purchase fee, there might be a monthly fee if there's some monitoring involved. And so you need to think about, is this something that we can afford? Is this realistic for us? But also on the flip side, will it save you money? If you've got some concerns about your loved one's safety and general well-being, maybe having something that monitors for falls and medication management will be helpful and will save you money if you don't really need to have home care all the time. You just want a little bit more oversight. So you might be able to save some money with technologies, but obviously that's a very important and valid concern to think about. The next thing you want to consider is around privacy. So if we go to the next slide, how much information is going to be shared and who are you sharing it with? Some of the tools we'll talk about today are not connected to an internet or cell service. And so you may have less of a concern about whether this information is being shared or secured. But you might want to include other family members or even paid providers or home care services in some of the information that you're tracking so that you are coordinating care across different individuals. So you need to, again, think about who's going to get those alerts, who's going to get those messages. And then the person who is needing care, are they able to understand and consent to what you're suggesting? And if they're not, who has that authority, maybe as a power of attorney or as a healthcare agent, to make those decisions on their behalf? So all just considerations to think about. The next piece, which I think is also the big one, is the ease of use. How comfortable are you actually with technology? How comfortable is if there's anybody else who's going to be using these particular tools, how comfortable are they? Is it going to be hard to install? Is there assistance from the company on that? Who do you call when you need help, when you don't understand how to do something? And then do you even have the underlying infrastructure in place? If it requires that you have Wi-Fi or have a really strong internet connection, if you don't have that, this may not be a particular tool that's going to work for you. So you need to be thinking about what's realistic given, again, your situation. FCA is trying to develop some additional resources and gather together information that provide more resources about accessing internet, either low-cost services or how else you can get internet if you don't have great access, and keeping that information up on our website. So there will be more there, and I'd say definitely check back with us for more of that. If you maybe live in an area that you don't have great internet access and there are certain tools that you really want to use, or if the cost has been prohibitive and that's not been a great resource. So we'll try and be updating that information to provide that as another resource to help people out a little bit more. This quote here at the bottom, when we're thinking about kind of ease of use and comfort, it says, "Sometimes I think it would have been nice to have had a child, just for the tech support." And that was actually my uncle one year at Christmas when he got this great new digital technology device and had to figure out how to set it up. So those, again, are really important things to think about. You don't want this to add to the stress in your life. You have enough of that. You want to think about what are the things that are going to help make my life a little bit easier and decrease a little bit of my stress a bit. Okay, so a couple more items to think about in choosing a technology is, how do you find what's available? You obviously can just search on the internet. There's lots of stuff out there. It can be a bit overwhelming though, and it can be hard to know, is this a legitimate service? Is this something trustworthy? Is this actually going to work for me? I really encourage people to talk to other caregivers. Talk to other people who are in similar situations, whether it's just caregivers people in support groups, but really talk to other people to find out what have they used and what has been helpful for them. Talk with people in the aging services field. So from senior centers, if you're in California, from the caregiver resource centers, and look at some of those websites that are specifically related to caregiving and aging services, because we'll be able to try and help narrow it down for you a little bit. And again, the lists that we'll provide for you afterwards, they provide some examples. They're not necessarily all going to be right for you, but just to provide some more specifics on some of these tools that we'll talk about. Good to look at the company, their history. Did they seem reputable? Who they've worked with? The challenge with technology is that this is constantly changing, and there's always new companies trying to get into this space and develop new devices and new platforms. So it's hard to judge sometimes the companies by longevity because they may not have been around that long. So again, you just want to keep an eye on that when you're thinking about things. But at the end of the day, is this going to meet my needs? Is this going to make my life better? What are the limitations and abilities of the person using it? And that might be the person you're caring for. It might be you'll be the primary user. And so then thinking about, again, your comfort level with technology. And then what do you want it to do? And is it going to meet that need? Those are all really the pieces that we want to think about. We look at the next slide. The other piece around choosing a technology is, again, kind of finding it. How do you find one that feels like a good fit? There are in various areas lending libraries, essentially. So places where you might be able to borrow particular devices to try them out. It might mean borrowing an iPad so that you can try out a certain app, a computer mouse that's more accessible for somebody who has some challenges with fine motor movements, pocket talkers, the hearing devices, something we'll talk about a little bit later. Those are all things that sometimes you can borrow and try out. I have also had some caregivers have good experiences with reaching out to certain companies and saying, can I try it before I purchase it? And there's been a few times where they've been able to do that. So it does not hurt to ask. But check in with your local senior center to see whether this is something they have available. And also the independent living centers. A number of them participate in something that's called an assistive technology exchange. And you'll see the link here. And again, this will be posted afterwards, and we'll send the slides out. But you can see whether there is one of the local assistive technology exchanges near you where you might, again, be able to kind of try out and borrow some of these devices. So it's a great way to see, does this feel like it's something that would be helpful for you? Would this be useful? And so I would really encourage you to do that. Okay, so let's now get in a little bit more to some of the really specific tools. So if we go to the next slide, we'll look at this broad category of direct care. And so there's a couple components that we'll talk about within that. And the first one that came up for a number of people is medication management. How do you make sure that the person that you're caring for takes their medications when they're supposed to? Or even for yourself, if you have a number of medical conditions, with everything that you're juggling and trying to manage, how do you make sure that you remember to take your own medication? So you might think about this from both perspectives, both the person you're caring for and for yourself. There are some medication boxes that will have a reminder. So an alarm will go off when it's time to take that medication. There are a number of different apps that you can install in your phone that are specifically for medications, and they will set a reminder and let you know when a medication is due. Those are a little bit different than just putting a reminder in your calendar on your phone. When you use one of the medication apps, you can put in the particular pill and say, it's Ativan and we're going to take it at this time of day, or it's, Aricept or Namenda if you're caring for someone with dementia. If you put in the number of pills you have left, it will also give you reminders of when you need to get a refill. So it lets you track the medications, it lets you keep track of the dosages, and then note whether the medication was actually given. There are some of the pill boxes that will actually stay locked until the appropriate time to take the medication. So each little square that represents a particular day and time of day is locked until that specific time occurs, and then it will open and allow somebody to take out the medication. And that's to prevent people from taking medication too frequently if they don't remember what day it is, that they can't go into Thursday's medications when it's still really Wednesday. Some of those systems, if you actually connect them to the internet, will send an alert to you as the caregiver and let you know that this person has gone in and taken out their medication. What you'll notice with all of these is none of them tell you, did somebody actually take that medication, put it into their mouth and swallow it? It lets you know maybe that they took it out. It gives you a reminder. It doesn't allow them to take more than one medication, but it doesn't actually let you know, did they actually swallow that medication? So really important, again, to think about what are their capabilities. If somebody is mostly independent, if they have the ability to follow instructions, these can all be really great. If there's a little bit of maybe memory loss or problems with dates and times, might still be very helpful. If they have dementia to the point that they're not going to remember what that alarm is for, then it might not be as useful. So again, you need to think about for your specific situation. We have also heard from caregivers that use things like the Amazon Alexa or the Google Home, and they will create reminders within that system to let them know that it's time to take medication. And we have heard from at least one caregiver that if she reminds her mom that it's time to take her medication, mom doesn't necessarily do it. If Alexa reminds her mom that it's time to take a medication, she is much more likely to listen to Alexa than she is to her daughter. So you might find that you want to get a little creative with it, and think about again what would be the most helpful for you and the way to go about doing it. The other type of medication management tool that's available are prescription bottles that have certain code put into the label that will actually speak out the prescription information out loud. So if you have somebody who has visual impairments and the issue is that they just need to make sure that they're picking up the right medication bottle, or remembering exactly what the instructions are, it either through their phone and an corresponding app that they download, or through a particular device that kind of looks like one of those old portable CD players. They hold it up to that and it will speak out the medication information for them. So another option as well. Your pharmacist might be a really good resource for what some of these tools are. And again, we'll include some of this information on the handout that you'll get. The prescription bottles that will kind of speak the information, those are more likely to be covered by insurance, just because of the type of information that they're providing and the idea that it's for people with visual impairments, the possibility of you being able to find that covered through your insurance is a little bit better. Right now, most of the other pillboxes are generally not. Doesn't hurt to ask your insurance company, to talk with your doctor about it. We know that problems managing medications can be a very common reason for hospitalization. So I think if you can make the case that this is going to keep somebody healthier at home and out of the hospital, it's worth kind of giving that a try. Some of them are going to be just the purchase of a device, and that's it. And then there might be others that are going to have a monthly fee if you're asking it to, say, do things like send an alert to you, the caregiver. That means it's being connected to the internet. There is a kind of process and a monitoring component involved. And so those tend to then have those additional fees as well. I do see a question coming through about fitness watches, letting you add this type of reminder. Fitness watches, if you're thinking about things like Fitbit, to my knowledge, not specifically around medications. There might be reminders to them, but they may not be so specific to a medication. If you have another type of smartwatch, things like the Apple Watch or I don't know, any of the other tech companies that have them, where you can set more features and functions and sync it to your calendar and you can sync it to different apps, then yes, I would say you probably can do that. If they have a smartwatch on, you would be able to potentially sync it to those, to the other functions that are available within your smartphone. So worth kind of exploring that if you feel like they would be able to respond to a reminder coming from their watch. Okay. So if we move on from medication management, let's talk about some of the other components of direct care and health. If we look at the next slide, let's think about kind of broader healthcare management. And this is, how do you just make sure that somebody is staying healthy, that any chronic conditions they have are being well managed, that any of those symptoms that you need to then discuss with the doctor, you're able to track and monitor appropriately. These are some of the tools that might help with that. There are different types of devices that will allow you to track somebody's blood sugar or track and keep track of their blood pressure levels. And some of these, when we look at the true telehealth models, where there are these devices that are going to get sent out by your doctor and they immediately communicate that information back to your healthcare provider, those are some options. Others are ones where it's just a way for you to track. So if you see the little picture in the bottom left-hand corner, it's called Glucose Buddy. And for somebody who is diabetic and needing to keep track of their blood sugars and glucose, it's a way to make sure that you're remembering to check it, to track it, to keep track of your food intake at the same time so you can see those patterns. And so again, it's a way to manage your symptoms and make sure that you know what's causing some of these symptoms when you have a particular chronic health condition. And it allows you then to communicate this back to your doctor and healthcare provider in a really concrete and specific way, where you can say, it seems like it's gotten worse because these are what their measurements are over the past week. And I think it's related to maybe a new medication, or again, particular type of food, or stress, because these are the events that are happening at the same time I'm noticing the symptom getting worse. And it allows you to really see those patterns. Activity monitors can be another great tool, and these are some of the things like Fitbits and stuff. When you're just trying to see how active is somebody, how active am I as the caregiver, wanting to make sure that you're really keeping busy and engaged, especially right now when everyone is staying a little bit closer to home, it might be a really useful tool right now to use. Personal health records come in many, many different forms. This can be as simple as a notebook or a binder where you are keeping track of somebody's current medications, you're keeping track of past surgeries or other healthcare visits, and that can be a really low-tech way to do it. but there are also online tools that you can use. You might find that your insurance company or your medical provider has a electronic medical record that you can access, where you can see information from recent doctor visits or from lab work that was done. That can be really helpful when you want to keep track of that information that comes from your doctor. But if you want to keep track of kind of the larger history of someone's health and their medical history, that may be where you may have seen multiple doctors or multiple providers, you may want to keep track of this separately in your own personal health record that is not tied to your medical provider. This also potentially allows you to share this with another person. So if you've got a couple family members that are involved in one person's care, and you don't know who's going to be the one that's going to take your family member to the doctors or to the hospital in case of an emergency, you might want to have more than one person who has access to this health record. So it's a way for you to put up that information, to share it with a select person should you choose to, and to know that it's then always available. That in case of an emergency, you don't have to remember, did you grab that notebook when you went to the ER? You would have it with you if you had your smartphone with you. There are some that just have a website and others that will have an associated app with it. You want to make sure that it's something that is password protected, that if you're transferring or sharing info, that it is done over an encrypted and secured connection, because this is health information. So you do want to be cautious and careful with that. So that can be a really great resource. And there's a number of them that are out there. WebMD has one. There's a couple of others that are maybe more specific to advanced healthcare directives or some of your legal and financial planning storage. So there's a few different options. And I see that somebody has added one, sounds like they might have used as well, into the chat. So definitely can be a good option for you, again, especially if you've got maybe multiple people that you are coordinating care with. That can be helpful. All right, so if we continue on in direct care, we're going to look at one of the other broad topics around communication aids. And these can be things if you have somebody who has challenges with their hearing or their vision or their speech. So these are often some of the more low-tech tools that do not rely as much on your internet connections, but they may be more standalone tools that you might be able to use. So for somebody who is very hard of hearing, there are a number of different types of devices that can help amplify what they're hearing. So obviously a hearing aid, that's the most common one that we all think of. What we often will hear from caregivers is how often those get lost, and we know that those are really expensive. And so depending on the level of hearing loss that somebody has, there may be some other options that can work as well. I did a home visit once with a client, and I walked in the front door and that television was blasting. It was really loud. And she said, her dad couldn't hear very well. And so he always would turn the TV up a lot. So one of the things that we talked about is something that's called TV ears. And there's a number of different brands and types that are out there, but it's something that you plug into the TV, and then dad puts on his headphones and he can control the volume then as loud as he wants without the rest of the family in the house having to hear it in the same way. One of the pictures there at the top you see is something called a pocket talker, and so it acts in a similar way. You've got the headphones on and you have this little device that you can wear around your neck. It has a microphone and it amplifies the sound of the person that you're talking to. Not so great in a large group, but can be really helpful in one-on-one conversations. So talking individually with family members or in a doctor's visit when the person can't maybe hear as well, it can be something that is really useful. In California, the California Telephone Access Program can provide free phones for people who are hard of hearing that have amplified volumes or have visual alarms, so it lights up when there's a phone call coming in as opposed to just a ringing. So there's a number of different tools, and with some of the smartphones and with some of the hearing aids now, I know there are some that have Bluetooth capability directly into the hearing aid, so you don't need to have a phone that necessarily can go as loud as you need to because it goes straight into your hearing aid. So different options for that. For visual alarms, again, there can be some where the phone will light up when a call is coming in, but you can also get a doorbell or an alarm clock that will light up and to alert you when somebody is ringing your door, or rather than just your alarm clock making a noise, it's going to light up and let you know that it's time to wake up, or whatever else you may have set your alarm clock for. And those are all ones that can easily be found in most types of home improvement stores or other online stores. For low vision tools, definitely there's the old school, having that little credit card size magnifying glass or square that lets you read a menu when you're out, or read a book, or read a piece of mail. There are also now apps on your phone that actually will use your phone's camera to magnify it. So if you always have your phone with you, it's another way to help magnify what it is that you're seeing. You want to think about kind of telephones with large numbers, and this is very easy to find in landlines through some of these more specialized programs and California Telephone Access, or some of the assistive device stores are easily going to have that. It's been more challenging in the past with smartphones. If you're trying to get a cell phone or any other type of smartphone, it's been harder to find those that have bigger buttons, but there are a number of more simplified, both flip phones, those two still exist, and the smartphones that you can find. They're going to have bigger, more simplified buttons, both for people who have low vision or for people who are having more problems with fine motor skills, whether due to tremors or due to arthritis. There are some of the companies that will sell those cell phones where it's a little bit bigger. So places like Jitterbug are going to be some that do that. So those are options as well. And then for people who, again, are having problems with vision, there are some text-to-speech tools that will read the text and speak it out. Obviously, the simplest things is think about audiobooks, but there are others, if you just have a piece of mail or a magazine, that those tools will actually read it out for you. This is where connecting with any of your low vision programs, Lighthouse for the Blind, or any of the other services and programs out there that support people with low vision, they are going to be a great resource for more information on this. And both for hearing and vision tools, occupational therapists are a great resource to be able to help you figure out what's going to be the best one for you, and might be able to have some that you could try out and see, does this feel like it's a good fit? For people who need speech enhancement tools, so they either have a very soft voice, and this might be due to Parkinson's or certain other health conditions, they can help amplify the voice so somebody doesn't have to strain as hard to speak out loud. So it's kind of like a microphone for themselves that help them speak louder. And then there are some other speech generating devices for people who have really lost their speech. So we think often about ALS patients who might not be able to speak anymore. And you may have seen some people who will speak with the computers that they use their eye movements to create the speech. And that's obviously much more complicated and requires a lot more setup work. For others who might have a little bit of hand movement still, there are some apps that you can get on like an iPad or another tablet that actually allow you to create a message, respond to questions, create a story, and respond to people with that. And so you would respond using the app, and it would speak out loud so the people that you're talking to can hear what it is that you want to say. So Verbally is one of the apps that allows you to do that. And again, it's something that you can download on a tablet, and with a touch screen, they can put in what their messages are, create custom statements, or respond back to questions. And so those can be great resources. A speech therapist is a really excellent resource that can help you, again, identify some of those tools and things that would be really useful for you. And take a look quickly at some of the questions that come through. So whether more than one person can use the TV headphones at the same time, I believe so. And it's going to depend on which one you're buying, but I think that they are able to have multiple ones working. Probably a product that's going to be a little bit more expensive than the very basic ones, but it is definitely an option to do that. The other question around getting healthcare providers to talk to each other, especially from when they're within different systems. I wish I had a technology tool that would help you with that. And unfortunately, I don't really, other than to say, if you have your own personal health record, that might be useful, because even if they're not talking to each other, if you are uploading and keeping copies of doctor summaries or recent surgeries or other responses, then you would be more able to share that with one of those other providers. And unfortunately, there is not another simple technology that's going to get our healthcare providers to communicate with each other across symptoms. I wish I could tell you that there is. So other questions around resources for providing distant tech support, that I would say, keep an eye out. We'll try and send out more information as we're gathering it, but that's the kind of resource list I referenced at the beginning around technology access and training, and we're trying to gather more of that so that people have it. It really varies, unfortunately, location by location. So it's not always universal, but that is something that we will try and gather a little bit more of for you as well. So we'll try and keep track of that. Okay. So in terms of explicit apps or info, again, we will send out a resource guide that goes through some of these that is going to have more specific apps. What I'm hoping today is that you can think about these things in terms of the broad terms to figure out what is it will actually work for you, what's going to be helpful. And then when you get the list of example tools, that will be able to help guide you to very specific ones. Again, they're not necessarily ones that we can say that we're recommending or endorsing, but that will have done some of the research for you that fit within these categories. So I'll try and highlight some of the examples as we go through, but it's really going to depend on which of these is most helpful for you. Okay, so let's move on to the next section around kind of direct care and thinking about how do we keep people engaged and busy when they're at home. And this is something we're hearing a lot from caregivers right now. When some of the external resources and services are not as available, when you may not be able to have family members or friends kind of come over and visit as often, what do you do during the day to kind of keep people busy? And there are some programs that help people kind of reminisce with photos. So you might think about having a digital picture frame where you can upload a number of pictures and it will cycle through those different pictures over time. So rather than just have to have one photo in a frame or 10 different frames, it allows people to see multiple pictures all at once. There are some apps for tablets. You see this one here called Gray Matters, and it allows you to upload a picture and then put a little bit of a story with it so that you've got some context to it. And you might find that if the person you're caring for is able to engage directly with technology themselves, they would be able to open that up, look at it, and read the story and be reminded of those memories, especially if we're looking at long-term memories and older pictures. But it can also be really helpful if you have maybe a home care provider coming in to help with care, or maybe it's even grandchildren coming over who don't know all the stories. It can be a way for them to engage with this person and be able to see the pictures, get a little bit of context to it, and then together be able to talk about that and be reminded of those those old memories and old families. So that can be a great way, again, for somebody to look at potentially on their own or to do as an activity with another person. Music is an amazing resource, especially for people who have dementia. They really respond to music in a way that they may not be able to respond just through words. So thinking about what are some of the tools that you can use to help engage them with music. I really recommend, if it's something you're thinking about, to take a look at the documentary called Alive Inside that really focuses on the impact of music for people with dementia. But what they did is they created just customized and personalized iPods that people could listen to. So iPods may not be as used anymore. You might just have a playlist on your phone that you would create. But what's the music that that person enjoyed in the past? And how do you make sure that that's easily available and something that people can connect to over time? Another great resource around that is something called Music and Memory. And so their website is just musicandmemory.org. They've got some great tips around how to engage people with dementia with music. And you might even think about just creating a Spotify playlist or Pandora playlist, again, with the music that somebody really connects to and that's important to them. That way you have it easily available to play for them, or anybody else coming into the home would be able to know this is something that this person will like and enjoy. There's always a concern about wanting people to not spend too much time just sitting in front of a TV. And that's very true. We want to keep people as active as possible, but still might be enjoyable at times. So think about old sitcoms or musicals when you've got somebody who has some cognitive impairment or memory loss, something that is going to be nostalgic for them, something that doesn't have a super complicated plot, but that they can enjoy kind of moment by moment, and that can be really a nice, enjoyable activity for somebody. So that might be useful for them. The one potentially good outcome of everybody having to kind of shelter in place right now is this increase in activities virtually. There are a lot of senior centers, community centers, and other programs that are trying to put more of their classes and activities online and allowing people to participate remotely. The challenge for caregivers is that it often means you have to set it up. You're not always going to be able to let them do it fully independently. You might still have to be engaged. So that's going to be potentially a little bit of a challenge. It's not a total respite for you. So that's potentially the downside to it. But for those who are a little bit more independent, it might be something that they can participate in. So I would really encourage you to look at your local senior center, check out whether they're offering some of these programs online. Family Caregiver Alliance has a series that we've been doing for the past few months and that will be starting again in September in coordination with a local organization called the Hummingbird Project, and it's an armchair travel. So together you join, and each week you visit a different place or a different country, and there's pictures and you're talking about the travel to those locations. So when we're at a time where we can't physically get to them, it can be a great resource. So that may be something that you might consider participating in as well. There are a number of online exercise videos. You always want to talk to your doctor first, make sure that they're appropriate, maybe get recommendations from a physical therapist. But the YMCA and a program through the National Institute on Aging called Go for Life, both of those have online exercise videos that are specifically for older adults and those with mobility issues. So those can be a really great resource and tool to keep somebody active at home when you can't get out as easily. So I would say consider that also. Couple of the questions I'm going to hold for a moment, but I see somebody mentioned Sit and Be Fit. That's also a wonderful series. It's something you can purchase, but I've also seen it just on TV sometimes. So I know it's more readily available depending on your area and where you live. And I think it's usually on like the PBS type of stations if I've seen it on TV. One person commented the best picture frame they found is at skylightframe.com, and a frame that the children email photos to and they show up in the frame. And there are definitely a few of those that are available. And that's a great one where people can send the pictures directly to the frame. People can look at them, kind of cuts out some of that need to download or understand some of the technology. And that's great for somebody else who's been singing with your father. Wonderful tool. One that is mentioned on the handout that you all get around that, there is an app called SingFit, so SINGFIT, that is designed to how do you sing along together with songs. So it's meant to kind of create that environment where you can sing together. They do it both for, there's apps that you can download just as individuals in the home, and then they have some that are set up for assisted living facilities or senior centers or larger programs like that. So that's another resource. There's another comment in here on, maybe for Vox, AccuVoice for the TV, where you can up the vocal track and lower the backgrounds or certain sound ratios. So that's great. And maybe if Calvin or Arl, if you want to copy that over into the chat so other people can see that information, that would be great. And, just to comment, yes, these are all things that take time and you often have to engage with the person. So that's something to really think about. Is this something that is doable for you? And if it's not something that you can always do, who else can you engage that would help you do these things? So if you look at any of these and say, that would be fantastic. I think, my mother, father, husband, wife, whoever you're caring for would love this. Who else could do these things? Think about what are the other people in your life. And when we start talking about the care coordination, you might be able to engage people and have them kind of sign up or get more involved in this type of help with you. The sing-along app, it's called SingFit, SINGFIT. There's also a mention of Covia's Well Connected program. That's a fantastic resource. It's available. It started in San Francisco. It's available much more broadly now. And it's both online and by phone. They started completely as a phone-based program for activities, and then they've moved a little bit more into kind of virtual and online programs as well. So that can be another great resource for you to consider. And that one is as well on the handout that we'll send out to people. Okay. In conscious of time, I want to move on to a couple of the other tasks. So other things around direct care are around some of the daily tasks. So thinking about getting home delivery for meals and medications and supplies, much, much more common right now, obviously, and something to really think about. It often does have a higher cost associated with it, but for a caregiver with very limited time, this might be really useful and really helpful for you to think about doing. Around medications, many of the pharmacies now will mail them. Obviously, there's other considerations with that at the moment. There is a program called PillPack. It actually got bought out by Amazon about a year or so ago, and I haven't heard of any major changes to how it works, but they will send you through your pharmacy the medications broken up in little kind of plastic sealed components. So if you've got 3 different medications that you take at 8 a.m., all 3 of those medications will be in this little plastic sleeve for 8 a.m. so that they're already kind of dosed out for you. But a number of the pharmacies, again, will provide medications, and usually you're just paying your copays and you're not paying for the actual shipment of them. There are a number of programs, and this is really going to vary depending on where you live, a number of senior centers or community centers that have collaborated with and made arrangements with programs like Lyft and Uber so that you don't have to go through them directly, but you go through the senior center and you arrange your rides through them. Other programs will have their own volunteer transportation programs. So again, reaching out to your local programs to find out whether those are available and help take that off of your role as a caregiver. If you're looking for in-home care, obviously there's home care agencies out there that can provide it. For those who are trying to hire privately and needing assistance with that, there are some online attendant registries. Some of the local independent living centers have actually moved their attendant registries into an online platform where you can view and interview and screen individual workers. And then there are some other platforms as well. I think care.com is the one that most people have seen. You really need to be aware of and think about what it means to hire privately and what the additional liabilities and responsibilities are with that. But it can be another great way to potentially find a home care provider if that's something that you're looking for. For those who are worried about somebody spending more than they should, not being able to track and manage their own bills, things like prepaid debit cards can be really helpful. That can be a useful tool to help make sure that somebody doesn't spend more than they should spend at any given time. The picture you see here, TrueLink, it's essentially kind of a prepaid credit card in some ways, but basically it's limiting how much gets spent at different types of services. So if you spend more than what is expected at a grocery store, it's going to send that alert to the caregiver. So it's a slightly more passive way of tracking for somebody maybe who has the early stages of dementia and still wants to be independent, still wants to be able to go shopping on their own. And that might be a way to assist with that. And then think about really setting up online bill paying. I have a number of clients who worry that they lose bills because the person they're caring for likes to check the mail themselves and they're not always sure where that mail has ended up in their house. So really encourage people to think about setting up online bill paying. The other kind of resource and daily task that I would think about, there are some of the utensils that can help adjust to people who might have tremors. So you see that little spoon in there that has the really thick end. For somebody who has tremors, it helps counter those tremors and allows them to eat more independently. Gillette, the razor company, has a razor that's designed specifically for assisted shaving. So if you are trying to shave somebody else, it's designed to fit an angle with your hand as you're trying to shave them. So that can be another resource for them. One of the questions about whether Medicare will pay for transportation costs. Medicaid often will. If you have a Medicare Advantage plan, I would say for any of the stuff that we're talking about, reach out and ask them. There's been more discussion in recent years about insurance covering things that are considered social determinants of health. So not just your doctor visits or your medication or surgery, but all these other aspects of your life that impact your health and well-being. And so that can be a way to ask about that. This is something that's going to keep this person healthy at home or allow them to get to appointments. Can it be covered? And it's worth asking for that. The Gillette razor, it's called Trio. It's TREO. And again, that will be on the handout that we'll send out to people as well. Yes, somebody mentioned there's a few of the senior specific digital tablets. So when we're talking about photo sharing or some of the other activities, GrandPad, I think is one of the more common ones out there. But a lot of the tablet companies are trying to do more simplified ones right now. So that can be a great way to help people be able to use these tools without as much kind of busyness to it. All right. So I'll try and get through some of the more questions, and if we don't get to all of them today, we'll include this when we send it out as well. But I want to make sure we get to touch on some of these other things. So a couple of the other, as we move on from direct care into more home and safety issues, a huge concern for people is, what if somebody falls? So most people have seen the personal emergency response systems. These are the buttons with the commercials that says, I've fallen and I can't get up. They can be a great resource if somebody falls. That allows them to call for help if they're not able to get to a phone on their own. Some are connected to landlines, others will use cellular technology. So if you don't have a landline at home anymore, or potentially even if you're out in your front yard or at the grocery store and there's not maybe somebody else right around you, it allows you to call for help that way. They require that you be able to push the button though and call for help. So you might look for the ones that have a fall detection capability within it. So it will notice that drop and doesn't require you to push the button, but it will send out the alert that there is a need for help when you have that fall detection. I saw a comment or a question earlier about smartwatches doing that, and there's been some controversy around this, but one of the more recent versions of the Apple Watch, if you set it up and you put in your date of birth with that, if you were over 65, it would automatically turn on the fall detection component with it. And some people weren't happy about that because they said that's such an arbitrary number, and I'm a very healthy 65-year-old. I don't need that. But yes, a number of the smartwatches have these capabilities. There's a certain amount of functionality they'll have on their own, but there are some associated apps that help enhance that functionality as well. So if you have a smartwatch, that's another way to have this fall detection rather than purchasing a separate personal emergency response system. There are also a number of kind of sensor or alarm pads that you can use. So these are things you might put on the floor next to a bed. So if somebody tries to get out of the bed on their own and their feet go down on that alarm pad, it will set off an alarm and let you know they've stood up. The best ones are not going to set off the alarm in the room with the person, but they're going to set off the alarm in a room where you are. So you might have the mobile device that has the alarm on it. You're going to hear it. They're not, but it lets you know that they got up. I've had a client use it not next to the bed. She was okay with mom getting up around the room, but if mom left the room, and this was upstairs, and got too close to the stairs in the middle of the night, that's what she was worried about. So she put the alarm pad closer to the hallway where the stairs were. So that's when she would be alerted that mom was up and about and might potentially go down the stairs and be a higher fall risk. For those who are worried about somebody wandering, that they might try and leave the home on their own, there are the very simple door alarm devices. So you can put them one on the door frame and one on the door, and it sets off an alarm either at the side of the door or in a remote alarm unit, and let you know that the door is opened. Doesn't stop somebody from leaving the door and going outside, but it lets you know. So again, if this is somebody who's living on their own, not really a good option, or who's home alone during the day, not a good option. But if you're with them all the time, but still worried that while you're doing laundry in the kitchen, they might walk out the front door, this can be a really useful tool for them. More and more, we're seeing a lot of GPS products available that help track somebody if they do walk out of the house, so you know where they're going. And that can be really helpful. You see the picture on here of the insole. So it's something called Smart Sole, and you actually put it inside somebody's shoe and it has a GPS within it. There are others that are watches, and the watches actually may even lock so that the person can't take it off on their own. Others that are more simple, and it's going to be a little like keychain looking device that you attach onto somebody. The challenge with those is you have to make sure that they're wearing it. If they don't have it on them, then there's nothing to track. So the watches that lock might be more helpful as long as it's somebody who really does keep it on and doesn't unlock, isn't going to be upset or disturbed by having a watch on their wrist. So that can be something really useful. If they do carry a smartphone with them all the time, there are a couple of apps that you can install on the phone, and as long as you're within the same kind of network or you connect them together, you can track that person through their phone. Life 360 is one of those, but again, they have to have their phone on them. So if you know that they always carry their phone, then that can work. If they don't, then that may not be a really good option for you. So you need to kind of think about what is the right resource, what would be most helpful in terms of that particular person and whether it's going to be really useful. Some of the mobile personal emergency response systems, they will have a GPS to it. You need to look at whether they're really using kind of GPS or the cellular technology, because it can sometimes make a difference on how accurate it is. For the ones that have the fall detection, the question was like shaking a towel out, is how accurate are they that this is a fall and not some other movement? There's some room for error, and there's going to be. I think certain side-to-side movements are going to be fine. It's sudden drop movements. So, can it pick up on things incorrectly? Yeah, they can. Even if you just take it off and you accidentally drop it down, you might have that. But they will more or less work. You just might have some incorrect kind of positive responses to it as well at times. But those can be an option. The other thing that is still fairly new, so we're not seeing a ton of it yet, but there's one service called Ask My Buddy, and it connects with Alexa or Google Home. So if you install it there, it actually lets you know, it can let you know that somebody has fallen and there's a need for help. So rather than somebody having to push a button, they can just call out and speak to Alexa or Google Home and call for help through this Ask My Buddy service, and it will have a contact list of who do they call for help. So it's another way to kind of do it without a device that they have to wear, but just using some of these other kind of newer systems in place. That's going to, again, be most helpful for somebody who knows how to use Alexa or Google Home and is comfortable with that and will remember to do that. So again, you really need to think about that particular person and whether they're able to do that or not. With some of the wandering devices, some of the GPS ones, this is especially true for some of the watches and for some of the devices. So one of the small like keychain looking devices, there's one called iTrack. And both, there's a watch called TheoraCare and then iTrack, and there's a few others that are similar to this. They have something called geofencing. And what it is if you say, I'm okay with them walking out, maybe in the front yard, maybe even down the block, but if they move outside of this particular geographic area, this kind of virtual fence, then I want to know, then I want to be alerted. You can set some of those up. So again, for somebody who might still be able to be a little independent and kind of move about on their own, that might be a good feature to really look for in a particular GPS device, is that geofencing component. Okay, so a couple other things around home safety, and I did see this mentioned in one of the comments or questions, if we look at the next slide, around home monitors. So webcams come up often. Can I put a camera in to watch the person? Yes, obviously you need to think about privacy, but also you need to think about what are you going to do with that knowledge? How close are you? I know one caregiver, he used it. He went to a caregiver support group that was just about 10 minutes away from home, felt like wife would be okay, had dementia, home alone for that hour of the support group. But as the backup, he had a camera that went to his phone so he could look at his phone and see what was happening at home, make sure she looked okay, because he knew he could get home really quickly. If you live in another state, may not be as helpful. There have been questions about, can people use those in care homes? I would say reach out to your local long-term care ombudsman, talk with some of the other senior legal resources. On a recent call, an elder law attorney said that, if you're paying for that room, then you have a right to have a camera in there. How you're going to get that camera in there is the question. So it's something to kind of think about, but it is potentially a way to monitor and make sure that somebody is safe at home or getting cared for safely. Audio monitors, these are kind of your baby monitors. So it lets you be able to hear somebody if they're in another room and they're calling for help. It lets you know. And so that's a really simple and easy to find one. There are some that have a kind of two-way component where they can work like a walkie-talkie, and you might be able to push a button and speak back to them. So if somebody's calling out to you, you could push that button and let them know, I'll be right there, I'm just finishing the laundry. And that might ease some of their anxiety. I really recommend kind of motion sensor lights at night. So if somebody does get up on their own, you don't have to have the lights on all the time, but a light will come on and it lets them see a little bit better. It also might let you know that they're up and around and moving about if that's something that you're concerned about. Smart homes and home sensor systems have been around for a number of years now, but they're not super widely used. They're considered a more passive monitoring system. So there are maybe motion sensors that you'd put across a doorway. And if you know that dad is always up by 9 a.m. and it's now 10 or 11 in the morning and he has not crossed through that doorway, not set off that motion sensor, it will then send you alert. So it's not looking for activity, it's looking for the lack of activity within your normal routines. Others will say plug into an outlet where your coffee machine is plugged in. And so if dad normally gets up at 9, immediately turns on the coffee machine, if that coffee machine hasn't gone on, it's going to let you know that something plugged in to this device has not gone off. They can be pretty pricey. So some of them that are out there, TrueSense, Safe and Home, Presence Family, they're all going to run you often around like $300 for the devices, and then you're paying a monthly monitoring fee because they're letting you know if something is different, which means they're constantly paying attention to something going through these sensors. There's no cameras, but they're kind of just tracking that general movement to let you know when something happens that's outside of the norm. So they can be really helpful, again, for somebody who's really independent, wants to be on their own, but you want to have a little bit more oversight. They can be useful. And then one of the other pieces, the last around home and safety that I want to touch on, is around cooking. And this can be a huge concern around safety on the stove, the oven. The very basic, kind of least low-tech device you can get are, child safety knob covers that you can put on that stop somebody from easily being able to turn on the stove or turn on the oven. Some people will also remove the knobs from the stove as a way to manage that. But there are some more high-tech tools that are available that either will automatically turn the stove off if there's no movement near it within a certain period of time, or smart plugs. So you're going to put that plug into the outlet, you're going to plug the stove into that, and they've got timers. So they're going to turn off after a certain period of time. These are all more easily found for people who have electric stoves. It's much easier to kind of have some of these motion sensors or the smart plugs when it's an electric stove. When it's a gas stove, they're a little bit less commonly found, and unfortunately then also tend to be more expensive, but they can be available. So things like Cookstop or iGuard are available for electric or gas stoves, and so those can be a potential resource. They are really pricey, but if it's something that you're concerned about, they might feel like a good value to you if you're worried about it, because obviously that's a huge safety risk for people. So those are, and again, some of those will be on our handout for you as well. So if we look kind of the next areas around kind of community and essentially how do you keep people engaged? And this might mean coordinating care with other family members or friends, kind of sharing updates and information. So think about who are the people in your life that could be involved in some way, could help either take on certain tasks, and those tasks might be who come over and just provide some entertainment and engagement for the person you're caring for, or who can help with appointments or doctor's visits or picking up medication or going to the grocery store. So there are some shared calendars that exist. Lots of helping hands and Caring Bridge are two that have been around for a really long time. They're fairly simple setups. And you can create a page around the person that you're caring for, share information and updates, but also create a calendar that lets people know when tasks need to be done, when a doctor's visit needs to happen, or who could bring a meal over or pick up groceries. And you invite people to be part of your page and your group, and they can sign up for different tasks or different activities that you put on that calendar. So it's a way to let people know, this is what I need, this is what would be helpful for me, and then they can choose what they would like to do. And the thought is that when they're picking something that they would like, they're more likely to stay engaged and hopefully do it again. And we want them to stay as engaged as possible. There's another app, and this is the one in the bottom left corner, called Cozy. So similar model, that you're creating kind of a page around the person you're caring for. You're inviting people to be a part of it. But it also allows you to track medications. So if you have a home care provider and maybe you've got a couple family members and different people are taking on different aspects of someone's care, you can have each person, depending on who's with them at a time a medication is due, they can note that medication was given, and everybody who's on it can see that. You can have a shared grocery list. So when you're at the house and you notice what's needed, you can add it. The next person can add what they see, but it may be a third person who's actually going to go to the grocery store and pick them up for you. So it's, again, a way to really try and keep people engaged and involved and staying connected, and hopefully giving you more assistance with the different types of activities that you have to do for them. If we look at the next slide, some of the other ways to kind of keep that community and that engagement. Video chatting, obviously we've all gotten very familiar with that recently. You know, how do you stay in touch with other family members or friends? It might even be a visual check-in with the person you're caring for. One of the challenges is how to have them be able to pick up those video calls. This is where the simple tablets, things like GrandPad, can be really helpful, because they might be easier for them to answer a Zoom or a FaceTime or a Skype call. The other option that exists, and I know some people are a little bit more hesitant about this one, Amazon Echo Show is a particular device that it's a video calling. So in the same way that most tablets are, or any of the other Amazon Echo devices, but with the Show one, it has a drop-in feature. So if you have your accounts connected between maybe you and your mom's maybe in an assisted living, or she lives in her own home, and you have set it up and you have your two systems connected, it allows you to drop in, which means that you could initiate a call on her end without her having to push anything. Now, for some people, that might be a little invasive or uncomfortable when your face suddenly pops up on this video call on their end, but it can be a way to see them without them having to know, what do I do? How do I push this? What button am I pushing? Did I hang up on you? So it can be a useful tool. So something to think about. Again, just be aware of and think about the privacy concerns and what makes the most sense for your situation. And then look at kind of those online support groups. Many of the caregiver support groups that we're meeting in person have moved to an online format now. So when you can't get out and you can't get away, it can be a great way to join a support group. If you're in California, check in with your Caregiver Resource Center. We can provide you information on local groups. If you are outside of California, check in with a local senior center or your area agency on aging, and they can help direct you to what support groups might exist in your area. And you'll be able to see which ones have moved into an online form. But even if you can't participate in a live group, there are a number of kind of forums that caregivers will kind of post a more discussion board and share information and updates. And Family Caregiver Alliance has an email-based support group. I know the Alzheimer's Association has some message boards as well. There's another program called Smart Patients that they're going to have these online support communities that are grouped by particular diagnoses or by type of caregiver. And so that can be a great way to connect with other caregivers and keep up to date, but also just to be able to share information and resources with others. And then the last kind of general area that I want to talk about is that support for you as a caregiver. How do you manage your own health and well-being? So if we go on to the next slide, we can talk about some of the tools that are available to help you manage your own stress and your own physical health. And the first is around like meditation or deep breathing apps. They're so simple, but they can be a great way for you to, in short bursts of time, find things that help you de-stress and relax. And you don't have to do them for hours. You can do them for sometimes 30 seconds or a minute. So the one you see on here is a really basic one, but it's called Breathe to Relax, and it's just a guided breathing. When do you kind of inhale and exhale? And just to guide people in taking those deep breaths and to slow down. And when it's on your phone, it's something that you can potentially do anywhere. There's a lot of other ones out there now. Calm and Headspace, I think, are two of the more common and popular meditation apps that are available. With many of these more meditation apps, they will have a certain amount of functionality that's free, and then beyond that, there's a fee to it. So, think about what are the tools that are most helpful for you and most useful for you, and you might want to find one that's going to allow you to do that, either that's free or within a price that you feel comfortable with. UCLA also has a Mindful Awareness Research Center, and they have a number of free guided meditations on there. And then Family Caregiver Alliance has some relaxation exercises that you can listen to on our website as well. There are some really good apps. Senvelo is one, and Virtual Hopebox does it a little bit as well, where it helps you monitor your mood. How's your anxiety? How's your depression? Do you feel like you're getting more tearful, more irritated lately? And let you kind of track that so you can see how you're doing. And then journaling can be a great way. And if you're not somebody who really likes to handwrite, might think about doing it on the computer. There's a private online journal called Penzu, and they have it online, but they also have apps available. So if you're somebody who really likes to text, you might want to type your app as well, and those can be really, really helpful. And another great way to do it. And then how are you going to track your exercise, your sleep, again, your physical health, keeping track of how you're doing. So there are some apps like Sleep Blue and Twilight that help you adjust kind of the blue light levels on your phone. So they're helping to kind of reset that circadian rhythm and help make sure that you're able to get to sleep at night, because we know how important that is. Both of those, I think, also have white noise features to them also. So if you need that white noise to kind of help you get into sleep at night, those can be really good. So again, think about not just what is helpful in taking care of the other person, but what do you need to take care of yourself also. And so if we look on the next slide, kind of one more thing around that is around getting that counseling for yourself. Telehealth is much more widely available now than it was before, because the Center for Medicare and Medicaid Services has said it can be more widely available. It can be reimbursed now. So where you might not have been able to find individual counseling without going to see a therapist, it might be something that you can get now through video or through phone. So check in with your doctor or your insurance company. Generally, you want to think about HIPAA compliance, although that is part of what they have waived right now, is that people are able to use different platforms. But think about it. Making sure that you have that there's somebody is licensed in your state. USC has a telehealth program. I mentioned them because that is where the LA Caregiver Resource Center is housed. So we know that they have that connection and understanding of caregiver needs, and that can be a good and useful resource. And again, we're going to send out, so if we go to the next slide, we're going to send out kind of this information, the specific examples of some of the tools that I've talked about. So those will all be on there. But when you're looking for how do I get more help? How do I, connect with people who can really give that training and teach me how to do it? So many of the senior centers are offering these types of classes right now. Some public libraries do it, and lifelong learning centers. So check in with your local community. Reach out to your Caregiver Resource Center in California, and we can kind of direct you as well, and help get you connected to those specific types of services, and they can give you a little bit more guidance. I'm going to go through the questions in just a moment, but I will quickly kind of in these next couple slides just show you a little bit more about FCA, so you know kind of where to get more information. On our homepage, we have a program called CareNav, and it's where you can get personalized resources and information for you. We have tons of education and resources online. And if we go to the next one, you'll see kind of what that dashboard looks like for you if you create a CareNav account, and it's going to pull up resources around hiring in-home help or understanding dementia based on whatever your situation is. And then our Learning Center, again, it's going to break up our resources by things, articles you can read, webinars you can watch, the meditation exercises and all of that. So with that, we can go to our last slide that has our information, and then I'm going to do a quick skim through of some of these questions. I know we probably won't get to them all, but I will try and respond to these as well. Yes, we'll share the slides. We will share the resource list and send that out to everybody. I see a nap app, which just has a great sound to it that helps with sleep and focus called, I'm going to ask Al to move that one over because that's not going to come across very well, I found. Yeah, there's a number of great programs that are helping with technology and helping people get connected. So Senior Fusion is one that was mentioned. Senior Planet is another one that's doing a lot of this type of work. In San Francisco, we have a group called Community Tech Network and Community Living Campaign, all about how to help people get connected to technologies. And as I mentioned, FCA is trying to kind of gather some of this information and be able to share it. So keep an eye out with our newsletters and emails and check back in on the website, and we will try and provide more of that information as we're able to gather it. Another great recommendation in here, it sounds like a 5-minute journal app. Take photos, document what you're grateful for, plan your day out. Those that are really simple are really great ones. There's another app that is just called Gratitude, and it just reminds you every day to put down something that you're grateful for. So kind of the very simple journaling exercise. Electroniccaregiver.com, it sounds like another potential option of products and solutions, so that could be another great resource here. I see somebody mentioning Alzheimer's Association doing a monthly Zoom music bingo. So that sounds like that would be really fun. I would definitely reach out to them. I see somebody else recommending Calm, so that's great. Some convection burners preventing burns. That's outside of my scope as a social worker, so I don't know that I can respond to that. I'd say that's worth kind of checking in with maybe a home improvement store and seeing if they can provide some guidance around that. Stovetop sensors in No Home or Pioneering, so another couple of potential resources there that might be really great. Would love a phone where we can talk without my mom needing to pick up. So phone, I don't really know how to do that, but that Amazon Echo Show might be a good resource for you as well. A tool to stop the constant barrage of calls from solicitors. There are a couple. I don't think I put this down on a resource list, but I will try and add that before I send it out. I know I have seen them. There's a website called the Alzheimer's Store. So it's called ALZ Store, and they have a couple of them listed there. I have not had anyone use it that I know of before, so I don't know how effective they are. But essentially, they are kind of caller ID blockers. So I'll try and add that to the list before we send it out, but I know they are also on the Alzheimer's Store website, and that might be a good resource. So where to find attendant registries? Again, check out your local independent living resource center, or the other kind of national ones that are out there are care.com and care links. And these are both on the resource handout, but really good to look at your local independent living resource center because a number of them do provide that. So that could be a good option for you. I've skimmed through these and I'm hoping I've caught all of them. I'll do a better kind of look through and we'll try and respond and post these as we're able to go. Caregiving related apps help coordinate care responsibilities. So we talked about that. Lots of helping hands, Caring Bridge and Cozy as potential resources for that. So I think those are the ones that would be really helpful. And yeah, around the direct care ideas and how to do that when it requires a lot of one-on-one care. And if you're on your own, how to do that. That is a huge challenge. And I'd say think about who else can you engage. Definitely check in with what the resources are where you live to see are there other ways to get help or to get respite. And that might be really useful. And And I'm going to continue looking at these, but Calvin, as we're finishing up, if you want to post, put up the poll so that we have people are able to respond to that, we would really appreciate your feedback on this workshop and what would be helpful moving forward. And then if Calvin, you've seen any other questions that I haven't, please let me know.
Sure. A couple of quick questions. One, we had a listener curious to know how you might broach the topic of technology in terms of introducing it to someone. I know it would kind of depend on the person, what they might be, what condition they might be living with, but are there some ideas you might have in terms of introducing the care receivers to some of these technology tools?
Yeah, I mean, that's a great question. And you really do have to kind of couch your response based on that particular person and what they're comfortable with. I know around things like the home sensor systems, people have tried to use it as, well, I worry that something might happen to you. I know you don't want people in your home and you don't think it's necessary, but this is a way for me just to know if something goes wrong. I'm not going to know what you're doing all day. I'm not going to see you, but if something goes wrong, I will know. It will be a way for me to find out if something happens. And I won't worry as much, and this will make me feel better. And can you do that for me? And that might work for some people. I know there's a lot of fear about technology and I'm not going to understand it and I don't know how to use it. I know my grandma refused to ever touch a laptop or an iPad because she was afraid she was going to break it or do something to it. So we had one of the kind of digital picture frames so that she could see lots of photos without her having to do anything or set anything up. I think if the Echo Show had been around when she was still with us, that may be something we would have done because, again, she wouldn't have had to engage in the technology. If it's a tool that you want them to engage with, think about what would motivate them. Is it that they want to stay more independent? Okay, well, will this help them do that? If it's a way that eases your worry and anxiety, maybe that's something that they're willing to do for you. If it's something that's really just going to help you manage and track what's being done, then you may not have to engage with them as much with it. But think about what's going to motivate them, what's going to make them willing to do it. And who is somebody who might be able to help sell that? It might be you, it might be a doctor, it might be another family member. Engage physical therapists, occupational therapists, speech therapists. They can help encourage some of these things as well. Sometimes it is more helpful when it doesn't come from you and it comes from another person.
Thanks. And well, looking at the time, it looks like we just have time for one more question. And this might be addressed in the handout, but are there any maybe websites that people can use to research tools in terms of comparing and trying to find reviews of different technology tools?
Yeah, I will. This is definitely on the handout. There's the Alzheimer's store is a great place to browse for kind of products and ideas. Sometimes you can find those items cheaper elsewhere, but it's just a really well organized site that's useful. And then there's a local program to the Bay Area called Tech Enhanced Life, and they have these circles, these groups of older adults that kind of come together and rate and review products themselves. So they have some really great resources and information written online. And the founder of that, Richard Caro, has written a book along with a care manager around home sensors. And, you know, he comes from that background. So they've got some great information to share as well. But these will all be on the handout that we will send out to people.
Thanks so much. I think that's about all the time we have for today. I'd like to thank everybody for participating in today's webinar presented by Family Caregiver Alliance's Christina Irving. FCA webinars are always free. Next month, we'll be talking with Dr. Elizabeth Barnett about motivational interviewing, which is a communication technique to help motivate and inspire those you care for to be more active, social, and engaged. So might be an interesting tool for your toolbox as a caregiver. For this website, again, this webinar, it will be on our website, caregiver.org. We'll get out that handout to you that Christina has mentioned, of course. And you'll also be able to view the webinar, recording of the webinar on caregiver.org. So thanks again, Christina, for sharing your expertise and the afternoon with us.
Thank you all and take care.
The webinar is concluded. I know for Northern California people, we're dealing with some wildfires, so please, everybody, stay safe and stay well. The survey is going to be up. I'll leave it up just for a little bit longer in case you haven't had a chance to vote, because we do read all your feedback and we do appreciate it. So that'll end the webinar for now, but we will leave the polling up just for a little bit longer if you haven't had a chance to fill everything out. Thank you so much. And again, please have a great afternoon and stay safe.